So I'd like to share with all of you, I presented a case of erythema multiforme associated with herpes simplex. And we know that 90% of cases of erythema multiforme are related to herpetic infections. However, what was more interesting about the case I presented was the fact that the patient did not have any recent history of any outbreaks of herpes simplex. And the diagnosis of erythema multiforme came after long-term follow-ups, and the patient ended up having an extended case of EM associated with herpes without any recent flares of herpes. And it took us a while to get to that diagnosis. And there are cases of recurrent EM or continuous EM, and patients need to be on steroids for a little while. And we also try different drugs such as methotrexate or Plaquenil. We finally kept the patient from flaring. But let's remember that HSV virus can be associated with erythema multiforme, even if a patient does not have any flares. Clinicians should remember also that in some of those cases, sometimes we have to keep the patient on steroids for a little longer than the usual taper, but that's when we start thinking about adding some other drugs that are steroid-sparing agents as well. And like I mentioned, methotrexate or Plaquenil or the combination of both. And getting the involvement of a rheumatologist sometimes is important, which we did in this case because the patient had a positive ANA, and we could not find any explanation why the patient had a positive ANA. We initially thought the patient had lupus, but it turned out to be the case that the patient had previous exposure to parvovirus, B19, had exposure to Hep A and B virus, and sometimes those viruses can lead to activation of autoantibodies like a positive ANA. But it was a falsely positive ANA, and the patient never ended up having lupus. It was purely a case of bullous erythema multiforme. The patient finally, after 6 months worth of therapy, the patient is doing extremely well. Remember, in the beginning, he had blisters all over his body, in particular in the genital area, the hands and feet, and right now, no recurrences, and he's doing extremely well. But we had to keep him on a dose of valacyclovir, 1 gram, 3 times a day for a longer time to prevent the flares.